Почитуван председател.
Distinguished President of the Government, distinguished ministers, distinguished directors of the national health institutions, ladies and gentlemen, distinguished guests. Good day and welcome at today's high-level policy dialogue on health matters, opportunities and challenges in the process of expansion of the list of medicines reimbursed by the Health Insurance Fund. In the very beginning, we would like to invite the President of the Government, Християн Мицкоски, to address us. You may take the floor. Thank you. Distinguished representatives of the World Health Organization, distinguished Minister of Health, Dr. Taravari, distinguished directors, deans, national representatives, partners, ladies and gentlemen. It is a particular honor and pleasure to welcome you at today's policy dialogue, which is of particular importance because it touches upon a significant topic that affects each of us, ensuring access to medicines for all our citizens. This gathering reflects the government's unwavering commitment to protecting the health and well-being of every citizen, a commitment that lies at the core of our mission. Access to safe, effective, high-quality and affordable medicines is not just a healthcare priority. It is a fundamental right that strongly affects our collective well-being and our commitment to improving the quality of life for every single individual. This government achieved a significant milestone with the expansion of the list of medicines reimbursed by the Health Insurance Fund. This is proof of our commitment and proactive approach, as well as desire for continuity in tackling one of the most urgent challenges in our health system. However, while this step marks progress, our efforts do not end here. The challenges we face require continuous work, daily commitment, and determination. The priority is to ensure that every citizen has access to the medicines they need without facing financial difficulties. It is our duty to protect the citizens and serve our people. To overcome existing challenges and achieve the desired mission, we must work tirelessly. We must strengthen the cooperation of all government institutions and involve all relevant partners. We foster deeper cooperation between the Ministry of Health, the Ministry of Finance, the Ministry of Digitization, the Health Insurance Fund, the Agency for Medicines and Medical Devices, the e-Health Directorate, and other key stakeholders. This joint approach will enable us to deal more effectively with existing challenges and implement sustainable solutions. Our common goal is to build a healthcare system that truly reflects our commitment to improving the health and well-being of each and every citizen. By working together with commitment, determination, and clarity, we can overcome the challenges ahead and create a future where access to essential medicines is not just an aspiration, but a reality for all. I express personal gratitude to all national institutions and individuals for their commitment and cooperation in this vital undertaking, as well as to the World Health Organization for their continued support in the development of our country's health system. Together, we pave the way to a healthier future for each of our citizens. The state should create for every single citizen. Thank you. Thank you, Prime Minister, for your introductory speech. Now I would like to give the floor to Dr. Arben Taravari, Minister of Health. Minister? Distinguished Prime Minister Mickoski, distinguished Minister Dimitrievska, esteemed representatives of the World Health Organization, dear colleagues, partners, it is a special honor and pleasure to welcome you to today's policy dialogue, which is of particular importance for a health system because it enables access to basic medicines for all our citizens. When we started this government, we promised that we will improve the access to the basic medicines, and that will be one of the priority areas during our mandate. The recent expansion of the list of medicines is a proof of our commitment. However, this is only the beginning. Now we must focus on continuity of these activities to strengthen the cooperation between the institutions and to be sure that our health policies are effective and fair. We are speaking about more than politics. This is the health of our citizens. Each citizen deserves access to medicines they need in order to live a productive and dignified life. It is our work that directly affects the well-being of our population by reducing the financial burden for the families and by improving the quality of the health protection on national level. We are thankful for the consistent support that is provided by the World Health Organization. Their expertise and partnership are invaluable while we are moving through these challenges. With their help, we can improve our strategies, we can optimize our resources, all in order to enable each citizen in our country to have access to the medicines they need. Our goal today is to clearly and transparently define the challenges that our key institutions are facing while expanding the list of medicines, and to define the following steps that will be undertaken urgently. The next step is to investigate the opportunities for optimization of the funding as a guarantee that this list will be regularly revised following the needs of our people and the advancement of the medical technology. Our goal is to enable our collective efforts to improve the health and the well-being of the citizens. I would like to wish you a fruitful discussion today. Thank you. Thank you, Minister. Now, I would like to invite Dr. Nataša Zopardi-Muscat, Director on Health Policies and Systems in the Regional Office of the World Health Organization for Europe. You may take the floor.
Distinguished Prime Minister, honorable ministers, partners and colleagues, it is a real pleasure for me to be here with you in Skopje today, my first official visit to your beautiful country, and to be opening this event on a very important topic. Everyone, no matter their background or circumstances, should have access to the healthcare they need, whenever and wherever they need it, and without experiencing financial hardship. Without affordable access to safe, quality-assured medical products, achieving good health and universal health coverage only remains a distant dream on paper. One of our latest reports on financial protection, produced by our office based in Barcelona, showed that although coverage has improved dramatically in your country in recent years, catastrophic health spending is still a real concern, especially for poorer families. In 2018, 80% of out-of-pocket payments were for outpatient medicines, And these payments accounted for 42% of total health expenditure, far above the EU average of 22%. And this is one of the reasons why we are convened here today with you in your presence. Having served in the past as Chief Medical Officer of my country, Malta, a country with a population of 500,000, I understand the challenges small countries like yours face in ensuring access to medicines. And I, together with all of our experts at WHO, here in Skopje this week and in our regional office, wish to underline our personal commitment to working with you to find solutions, because we can find solutions even for smaller countries. Today, far too many families across the entire region are struggling to make ends meet and have to choose between paying for the healthcare costs or for food or basic necessities. This is not a situation that is only one being faced by your country. Rising inflation, disruptions to supply chains and medicines have only made matters worse. And again, when medicines are short, smaller markets are the first ones to face very difficult problems when it comes to access at affordable prices. So, while healthcare systems in small countries are very different, they actually share the same policy challenges. And we at WHO Europe recognize these challenges and we stand by you. We are here to support you with technical assistance and international collaboration. And given that your country has also recently joined our Small Countries Initiative, we are committed to facilitating also collaboration with other small countries to find solutions, to learn also from some of the experiences that they have faced and which have worked, as well as exploring together the outstanding challenges that remain. So today we are here to discuss the challenges that key government institutions face in revising the positive list of medicines, as has been outlined so eloquently by the Prime Minister and the Minister, and to identify potential strategies to accelerate this process. The positive list is crucial for achieving universal health coverage because it facilitates both disease prevention, sometimes by not accessing medicines early enough, more expensive interventions which are also costly in terms of comorbidity and life are not avoided when they can be prevented and avoided. I understand that for over a decade, the lack of regular and scheduled positive list updates has hindered the inclusion of established as well as novel medicines that perhaps have become the standard in clinical practice and that are available in many other countries in the European region. And this, of course, impacts on people and results in high out-of-pocket costs. I also understand the challenges that you face in updating the positive list, including the processes as well as insufficient funding. The needs and the demands always seem to exceed the resources that are available. But there are things that we can do, such as build capacity for health technology assessment and have a strategic view when conducting revision of pricing and reimbursement policies. There is also, in any small country, often a significant gap in expertise. And here we are sometimes disadvantaged when having to sit around the table to negotiate with multinational pharmaceutical companies that have very strong expertise across their profiles, particularly when it comes to the novel, high-cost medicines. This asymmetry often leads to small countries not being able to negotiate effective deals. Recognizing these challenges, 18 months ago, we launched the Access to Novel Medicines platform, and your country has been an active member for day one. Let me not give you the impression that these are only problems that are being faced by smaller, less affluent countries in our region. If I tell you that the first country to ask our regional director, Dr. Hans Kluge, who also conveys his regards, he is on duty mission in Ukraine this week while we are here, was Norway. Norway, a rich country, asked our regional director to put the topic of novel medicines and access to novel medicines on the agenda, because looking forward at what lies ahead in medicine, gene therapies and others, they were seeing that they were going to face huge challenges unless we tackle this issue at a European level. So we were bold. Within our regulations as a UN agency, we set up an innovative vehicle in partnership with industry, and this was a first. And I am pleased to say that the maturity of dialogue is something that I have not witnessed previously in the 25 years that I have been working in policy dialogues in this sector. Of course, there is still so much that needs to be done, but I believe that we have created a vehicle where difficult and honest conversations can take place, and where all countries can see themselves represented. Indeed, last July, we also organized a special breakfast meeting in the presence of industry for the Small Countries Initiative. For us as WHO Euro, today's policy dialogue is a unique opportunity to be by your side, to move forward together. We do not see this as a one-off event, but as a start of a meaningful engagement to ensure that you are able to fulfill the goals and objectives you have set for health and well-being and equitable access for your citizens. Thank you.
Thank you, Natasha, for your introductory remarks. Now we will hear from Dr. Akim Ali, representative of the WHO in our country. You may take the floor.
Esteemed Minister of Finance and Minister of Health, dear national partners, international partners and colleagues, a very warm good morning to you all. And let me start by acknowledging the warm welcome that I've received since I joined the WHO country office in North Macedonia as a representative 2 months ago. Thank you very much. I feel at home, and my Macedonian is improving daily. It is really a privilege to address you at this very important high-level dialogue today. A lot has been said, particularly from the Prime Minister's speech about the necessity to have good access to medicines in a way that does not create financial difficulty for people when they need it, that there is no unmet need. I think that is critical. I also want to start by acknowledging the important work that's already started in reviewing the positive medicines list. Thank you, Minister and colleagues, for the hard work on that. I recognize the challenge. It is left for me today to emphasize that whilst the progress has started, there is still an inordinate amount of work to do. The big task ahead is to create the systematic, institutionalized process that is safe, transparent, and is able to respond to the need of our citizens. I promise that with the strong, able team that we have in the WHO country office, my national colleagues, partners, we will be at your side as you go through this difficult, challenging process to satisfy the needs of the population. We will also do it in a way that recognizes the financial challenge, the technical challenge, and the operational challenge that you need to resolve. It is going to be based and grounded in reality, and I'm supportive of the work that you've already started, and we as a team will be behind you, beside you in this program of work. I'm also thankful for the expertise that comes from my colleagues across the region, led by Natasha, and of course our colleagues across the UN agencies and other international partners that we need to work with. I think it's really clear that the work that the stakeholders need to do does not stop at the Ministry of Health. It includes the work that needs to be done by the pharmaceutical sector, by the insurance fund, and of course by the clinicians and patients themselves who need these medicines. And therefore, WHO stand by your side, as has been highlighted, to share learning, knowledge, and practice that has created optimal position in other countries of similar size, shape, and ability and capacity. I encourage you today to fully participate in the discussion, to set out a journey ahead with a path that creates the route to the ambition that we've set to, in the next few months, work together to create a systematic process for reviewing the list on a regular basis and to be confident that the choices that we make will be affordable and will meet the needs of the population. I wish you a very fruitful discussion, and we'll be here all day with you as we progress in the discussion. Thank you very much.
Thank you, Dr. Ali. I would like to thank all speakers for their introductory remarks and the opening of today's high-level policy dialogue. Before continuing with the working part of the program, now we'll have a brief break for our speakers to be able to give their media statements in the media center of the government. You may go there.